Hello, this is Dr. Becca with Del Mar Center for Behavioral Health, and we are doing a short recording or workshop about understanding the special education process. This training or workshop came to be at the request of some of the families that we work with, and in understanding that the special education process can be very confusing. So I want to start by talking a little bit about who I am and my experience. I am a North Carolina licensed clinical psychologist, a nationally certified school psychologist, and a board certified behavior analyst at the doctoral level. I am the clinical director and owner of Del Mar Center for Behavioral Health here in Jacksonville, North Carolina. We are a behavioral health center of excellence, which means that we are in the top 10% of behavior analytic providers. And I am also an authorized continuing education provider through the Behavior Analyst Certification Board. I want to talk about sort of the special education process, and I also want to be clear and transparent that I am in North Carolina in the US, and so I am talking about the public school system, particularly here in North Carolina, and that if you are in an area other than where I am, when I'm talking about the federal regulations and guidelines, a lot of that will apply, and there are a lot of differences between states and school districts across the US, and also whether you're in a public school system or a private school system can also have an effect on how some of the special education processes may play out. So to start, to really understand the special education process, we need to talk about special education law. And in North Carolina, that's Article 9, Section 115C of the North Carolina General Statutes State Law is what talks about the education for students with disabilities. And then at the national level, we're talking about Individuals with Disabilities Education Act, which is often called IDEA. And that is special education law that is here to be sure that public schools are serving the educational needs of students with disabilities. And we're going to talk more about what that means, because schools and educational settings are focused on the educational needs of students. So some history about IDEA. In 1969, the Children with Specific Learning Disabilities Act is one of the included parts of the Education of the Handicapped Act of 1970. Then in 1975, Education for All Handicapped Children Act. Then in 1990, EHA, that's mentioned kind of in the line above, was replaced by IDEA. And then in 2004, there was the IDEA Improvement Act. And then in 2011, Part C was added, and Part C is specifically about children 2 and under. Today, we're mostly going to talk about school-age kids, which is actually 3 and above, because at the age of 3, the school systems, the public school system takes over or is able to provide services or assess a child to see if the delays are great enough that they need to provide services. And we'll talk more about this as we spend some time together today. So the process for identification, I want to be really clear that in the educational system or educational setting, we are talking about classification and identification, not diagnosis. And we'll talk about that a little bit on the next slide. So the process for identifying a student with a disability can happen in really 2 different ways. So one, the parent can request an evaluation, and that must be done in writing. And you'll see that's why that's bolded. Or school staff can make a referral for that evaluation. Then the district meets to plan an evaluation and get permission to test. They cannot do this testing without parental consent. The district has a time period to complete that evaluation that was designed, and then holds a results meeting. And in North Carolina, that's 90 days. At the results meeting, a disability determination is made, and if appropriate, an IEP or individualized education program is created. And this is a team decision. No one person on that team gets to decide. It really is a team decision, and parents are a super important part of that team. So I mentioned that in the school setting, it's really about classification or identification, not diagnosis. And here is a breakdown of the 14 disability categories that are outlined in IDEA. And I make this distinction because being trained as a school psychologist and a clinical psychologist, there's a big difference. So in clinical psychology, we use what's called the DSM, or Diagnostic and Statistical Manual. And in school district, we have like 200 and some different diagnoses that are mental health related. And IDEA is really focused on these different disability categories that may impact a student's educational performance or their ability to access the instruction or the curriculum. And this pie chart is from 2011. It's a bit dated now, right? It's 2018, and it was the most recent one I can find. So you can see here specific learning disability is the most commonly identified or occurring disability category, with speech language impairment, often called SLI, next. Then we have other health impairment that follows that, and then intellectual disability, emotional disturbance, autism, and then other less or lower incidence disabilities. So an IEP, Individualized Education Program. This is a document that contains the plan for the special education services that a child with a disability is going to receive from the school. It really is a contract. It says what the school is going to do to provide for the educational needs for the student. It must be reviewed at least once per year. The IEP meetings are held with the IEP team, and there are specific people who must be a part of that team. The parent, a special education teacher, a general education teacher, somebody who's representing the school district that can make decisions. And this person is often called the LEA rep, or which stands for the local education agency representative. And then someone who can interpret the results of any evaluations or testing. And so that could be the speech language pathologist if there was speech language testing. It might be the school psychologist if there was psychological testing. And it also could be the special education teacher or general education teacher who is interpreting some of the classroom data that's being used to determine eligibility and progress towards goals. There's some key terms to know in the IEP itself. One of those is FAPE, or Free and Appropriate Public Education. And this is the specially designed instruction and related services that will allow a child with a disability to make reasonable educational progress. And I want to be clear that it's about reasonable educational progress. It is not about performing to their very best or their very worst. And that appropriate word, so free, let's sort of tackle that piece by piece, right? So free means that it's at no cost to the parent. It doesn't mean necessarily that it's free for the school, right? Because the school district may need to pay for a speech language pathologist to come in, right? But there's not a cost to the parent. Appropriate is a pretty objective term, right? And so what's appropriate for one child will not necessarily be appropriate for another. And some examples might be helpful kind of when talking about this. So the US Supreme Court first addressed the requirement of an appropriate education in 1982 in a case called Board of Education versus Rowley. The case involved a deaf student, Amy, whose parents believed that to get an appropriate education, Amy needed a sign language interpreter, that without an interpreter, her parents argued she was not going to achieve to her potential. The Supreme Court rejected that argument. The court said that IDEA only requires that a school provide educational services that give an educational benefit, and that's in quotes, that's that specific language to a student. It does not require that the services maximize a child's potential. So because Amy in this case was a good lip reader and had other supports, she was making above average grades and was moving to grade without an interpreter, she was found to be receiving appropriate education without that sign language interpreter. In 2017, there was a case called Andrew F. versus Douglas County. This case involved a student with autism who had been receiving special education since preschool. By fourth grade, the parents were dissatisfied and believed that his continued disruptive behaviors were interfering with his progress, and the IEP was not offering FAPE. The school district proposed a new IEP that was essentially like the previous IEPs. His parents rejected that proposal and then filed a due process complaint, which we'll talk about later, to challenge it. The school district defended that IEP and said that the school's plan had allowed Andrew to make at least minimal progress. And the court ruled for the parents, saying an appropriate education is one that allows the child to make progress appropriate in light of his circumstances. So although not every child will achieve at grade level, progress must be more than just a minimal amount. And each IEP must be, and this is the language in quotes, appropriately ambitious. That's the language used, so that the child has a chance to meet challenging objectives for that child, right? So specially designed instruction is the instruction that will be provided by the special education teacher to help the student accomplish the annual goals. And then related services are what other services may be needed to help the child benefit from his special education program. So this could be speech therapy, it could be occupational therapy, it could be psychological support, behavior support, whatever other services may be needed to help the child benefit from the educational program. Some more terms to know are LRE, which stands for least restrictive environment, and this is the school setting that gives the child with disabilities the most chance to be with non-disabled children or students. And so this is important to know that LRE is not one specific setting. It is each child's LRE. So one child's LRE might be a self-contained classroom, or a classroom where the child is only with his or her peers who may all have disabilities. For another child, their LRE may be spending some pull-out time in a resource room. And then other time with his or her neurotypical peers. It's really going to depend on what each child's needs are. An annual goal addresses the areas of concern that are identified in the present levels of performance. Each goal is a statement of what the student should be able to do from 1 year from the starting date of the IEP. And it should be those SMART goals, right? Specific and measurable. And then an objective, it can be associated with an annual goal to break it down into easier to manage parts. So there might be a couple objectives that lead up to that annual goal. Some more terms to know is an IEE, an independent educational evaluation. This is done by an independent third party, but the school pays for it. In order to ask for an IEE, the parent should write a letter to the principal or to the exceptional children special ed staff at the school district level. The letter should say that the parent disagrees with the school's evaluation and that the parent requests an IEE. And it's important, this isn't just if you feel like you didn't like what the person did. I mean, I guess you could request it then, but the IEE is really about if you feel like the evaluation, the educational evaluation conducted by the school district did not truly capture your child, or maybe used an out-of-date test, or maybe didn't use the best test for what they were trying to identify. You can ask, or parents can ask for an IEE. Reevaluation. So all children who qualify for special education services should be reevaluated or retested at least once every 3 years. They can certainly be reevaluated more often if there's a specific need. for more information. And there's really two purposes for this. One, it helps the IEP team determine if the child still qualifies for special education. And this is important because it's not determining if the child still has a disability necessarily, but it does determine whether that disability may impede the child's ability to access instruction or make that progress in the educational setting. This can be confusing sometimes for families because if a child has ADHD, let's say, it isn't that the ADHD goes away, but it may mean that the child has learned strategies that he's been able or she's been able to close the gap between his and her peers and no longer needs that specially designed instruction. The other purpose is that the reevaluation can help the IEP team with planning for the future educational needs. A reevaluation can be additional testing, but it also can be conducted with the data that the school already has. So sometimes the school may say, we don't need any additional data. We have all the data we need to determine that the child still qualifies for special education services and to plan for those future needs. Or a member of the team, and parents are a member of that team, can say, you know, I feel like the classroom data and the school assessments that we have aren't enough, and I'd like the school psychologist or the speech language pathologist or even the occupational therapist to come in and redo some more formal testing. Transition services. So this is a special service for students who are 16 years or older, and the planning really begins at 14 by law. But of course, I would gently challenge that we really want to be starting to plan for transition as soon as the child enters school. And people often say, well, Dr. Becca, that's so silly. I'm not going to be planning for transition when a child is 4. But I think that we need to do that. We need to at least keep it in mind. We need to simultaneously educate and support the child who is immediately in front of us while also being thoughtful about who will this child be in 5 years, 10 years, 15 years, 20 years, right? We want to always be thinking about where this child might be going. We want to help the student be ready for employment, further education, and independent living. And these transition services are individualized for each student depending on their goals for that child's life after high school. IDEA defines transition services as a coordinated set of activities within a results-oriented process. These services really should be facilitating the student's movement from school to post-school activities, whatever that will look like for that child. ESY, or extended school year. This is a need for services or potential services that need to be considered every year at the child's IEP meeting. And there's 2 situations when a student would qualify for ESY. One is that the child has a history of losing skills that they had previously or behaviors that they had previously after extended breaks from school, so regression. And here's the second part that's super important, that they do not recoup those skills or regain those skills within a reasonable amount of time after the break. Some of the data suggests that after summer break, a reasonable period of time to regain those lost skills is about 4 to 6 weeks. It's important to note that this decision isn't made by a cardiac assessment, I call it, right? I feel like he has a hard time. It has to be based on data. So data needs to be taken after those longer breaks, like Christmas break or spring break, the previous year's data from when the child returned from school or returned to school after summer break needs to be evaluated to see if there's regression, and then regular progress monitoring to determine if the child recoups or regains those skills in a reasonable amount of time. The other situation where ESY is appropriate is when the child is at a critical stage in the development of an important skill and that a break in his or her education could make it so that he or she may not fully develop that skill. I can say in my experience, typically ESY is awarded or identified as being appropriate for the first situation listed more than the second. And again, that's not data other than my own experience. So what happens when the school and families or parents don't agree? Well, there are supports and a process to follow for dispute resolution. The first is an informal resolution, and you kind of work through that with the school at the school level. If that doesn't work, IDEA provides several dispute resolution tools. There are facilitated IEP meetings, and here in North Carolina, NCDPI, which is North Carolina's Department of Public Instruction, selects and trains neutral third parties who are available to facilitate IEP meetings. Mediation is sort of the next step up from that, where DPI selects and trains mediators to lead smaller group discussion and planning about the child's needs. State complaints, where written complaints to DPI are submitted to show a violation of special ed law or policy, and it has to be within the previous 12 months. So if your child's in 7th grade and then you're, something happens in kindergarten and you realize that something happened in kindergarten, it needs to be within 12 months. There's also due process. Due process is a legal process in North Carolina. It's heard in the Office of Administration hearings. During the due process, the parent has what's called the burden of proof. So it's really up to the parent to show that something was not done or that the IEP wasn't followed or was breached. IDEA entitles children with disabilities to a free and appropriate public education in the least restrictive environment. But these are really vague terms, and so sometimes parent and school officials may disagree on what special education services and placements a child should have under that law, and so that's why these specific steps are outlined for dispute resolution. It's important that all members of the IEP team are familiar with the rights and responsibilities both of the school team as well as the parent. The procedural safeguards or parent manual that's offered at every IEP team meeting. I've sat in so many meetings where parents say, "Oh, I don't need another one." That really is your Bible for special education law, your rights, your policies, your procedures, how to make requests for these different disputes, what to expect in IEP team meetings. There's often a really great glossary in there of all the different acronyms used or different language used that might be new or unfamiliar. So I really encourage pouring through that document regularly. Most school systems have them available on their websites now, which makes it even easier. They really encourage getting familiar with that handbook, both as a parent and as a school personnel. So what about discipline for special ed students? So particularly students with emotional and behavior disabilities are at risk for breaking school rules. So for example, some students, like those with autism spectrum disorder or ASD, may easily misunderstand social situations and respond in inappropriate ways. Or students with ADHD might act impulsively without thinking through the consequences and break school rules. Students with intellectual disabilities might be encouraged by more sophisticated students into doing things that aren't permitted at school. And students with significant emotional disabilities may not have the control they need to avoid getting in a fight or acting on their emotions when their emotions get the better of them. Schools are encouraged to minimize disciplines that remove kids from school. If there are lots of discipline concerns that are occurring, the IEP can be amended to add a behavior goal. An FBA or functional behavior assessment and BIP or behavior intervention plan are two great policies and procedures and supports that can be added into a student's IEP. There's a box on IEPs that says, does the student's behavior impede learning? And if that box is checked, there really needs to be an FBA and BIP as part of that child's IEP. It's also possible for an FBA and BIP to be completed without the student having an IEP, but obviously that's a separate, less formal process. We're talking about the FBA and BIP as being part of the student's IEP. These two processes, the FBA and BIP, must be used if the student has been suspended for more than 10 days in a school year. When a student with a disability engages in a behavior that has them facing suspension from school for more than 10 days altogether, or an accumulation of 10 days total, there really needs to be a manifest determination review. It's often referred to as an MDR. And this is a process that focuses on whether the behavior that led to the suspension is directly related to the disability. So in those examples I mentioned just a few minutes ago, it's possible that those behaviors are directly connected or are manifestations of the student's individual disability. The thing is like many laws, MDR law is really complicated. So whether the conduct that led to the suspension was caused by or substantially related to the child's disability, and whether the conduct was the direct result of the school's failure to implement the student's IEP. So these are the two things that the team is going to look at during this manifest determination review. What about IDEA Part C? We're going to talk a little bit about this as we're coming to a close for this presentation, but I just want to touch on it. And this is about for kids who are younger than 3 years of age. So everything that I've talked about so far is for kids 3 years of age and older. Remember, at 3 years of age, the public school system takes over responsibility for the child's educational programming, which a lot of times parents don't realize. They think, well, when my child is 5 and he starts school, then he is a part of the public school system. But typically when a child is 3, the school district may conduct an evaluation to determine if there is a global delay or enough of a delay in development that the child or individual meets criteria for special education services. In North Carolina, we have the ITP, which is the Early Intervention Program for kids birth to 3. The CDSA, or Children's Developmental Services Agency, oversees early intervention services. After the referral to the CDSA, they have 45 days to evaluate each child and determine what services he or she needs. And in a parallel process to the IEP, the CDSA creates an IFSP, and that's an individualized family service plan, and that's reviewed every 6 months. I appreciate those of you who took the time to tune in here and listen to this brief review of special education process for school-age kids. Here I have some additional resources. Again, they're North Carolina specific, so the link to that North Carolina Notice of Procedural Safeguards, which is the parent rights and responsibilities in special education link. Rights Law is a great website that has easy to digest information. There's nationwide or federal information, as well as information for specific states. And then again, another North Carolina specific resource is the Children's Law Clinic at Duke University, and the link is below there. Again, my name is Dr. Becca Tagg, and I have enjoyed spending the last 30 minutes doing kind of what feels like a whirlwind review through some of the special education process. I hope that it's helpful, and remember that it truly does take a village, and that those individuals on your child's IEP team or school team are really the experts when it comes to maybe curriculum and assessment, and you are the expert as the parent when it comes to your child, and you are an important member of that IEP team. Thanks for tuning in. Have a great rest of your day.